We are going to be today talking about the fiscal year 2026 priorities for Central Health. Central Health is your hospital district funded by you, Travis County taxpayers. If you have questions, we just ask you to keep your questions brief and on topic and give everybody a chance to have their voice heard. If you've asked a question, maybe consider letting others go first so they can ask questions as well. We want to focus on solutions and realities, and we would like for you to speak on your personal experience and your opinion, but not speak for others. And I think we all know how to do that, but just as a reminder, and a reminder to myself, by the way, because I like to talk as well, there are restrooms out the door to your left, down the hallway. You may have noticed there's food, lunch outside as well, and drinks, so we invite you to participate and partake in those. And there's a way for you to provide feedback during this conversation. There's going to be a QR code that's going to magically appear on the screen, I believe, when we get to that section, where you can, if you're that kind of person, you can just text in a question, which would be anonymous. And it's, thank you, and it's actually on your seat, Nora, Dr. Comstock. There's a QR code near you. And then also we're going to have a microphone that we will share. I'll hold the mic and let you ask questions. There's a little strategy to that. But we do want to hear from you, and we invite your voice. We invite you to be part of the conversation. This budget is designed to create more services, higher quality services for the people in our community, our neighbors, our family, and us. And so your voice is vital to making that happen. So we're so glad that you're here. With that, I would like to introduce the chair of the Central Health Board of Managers, Ann Kitchen.
Hi, everybody. As Ted said, thank you so much for being here today. You know, this is our 5th community conversation in 2025, and this one is our opportunity to share information about our budget priorities for next year and how we'll be using your tax dollars to build, and we're all about a better, more equitable health system for our entire community. So that's what it's about today. But the most important thing for us today, and the reason we're so glad you're here, is that we want to listen and we want to learn from you. We want you to tell us your priorities and your concerns. And we want to be able to answer any questions that you might have about the future of Central Health, your healthcare system, and any questions that you may have about how we are stewarding your tax dollars and how we're using those dollars to make sure that we have access to healthcare for everyone in this community. So I'm also just honored to be able to introduce our elected officials. I see Stacy Suits is here. Thank you for being here. I also want to say that we're very honored to have Commissioner Ann Howard, and we're going to hear from her in just a minute. She's been a champion for healthcare and mental health care services in our community, and we are really pleased to have her here with us today. So I'm going to turn this over to her.
Thank you, Ann. It's always fun to be with another Ann who cares about the community. Thank you all. I'll be the 3rd person to thank you for coming out today. It's really important that the community has input and shares, you know, your experience and your needs around access to healthcare. The buttons today talk about 2026, I hope, being the year of access. And I think you'll see in this budget a goal to create more ways for people to get the health care they need when they need it, and with an emphasis on quality health care. We all want the best, right? Like for our children, for our parents, and for ourselves. And that's what Central Health aims to provide to this community. Why is a county commissioner here, or the county judge who got called away to testify at Kerrville? Well, the way Central Health was set up, the county is a partner. We appoint board members like Ann Kitchen, but we also approve the budget. And so it's important for us to know that Central Health is reaching out into the community and getting feedback. And you're also welcome to give us feedback and to participate. It's so good to see you. I haven't seen you in a long time. To participate in the public hearings we'll have together. So thank you again for being here. You know, when you think about what's going on right now across the state of Texas and, you know, vulnerable folks who have lost everything, life and property, to flooding, we are reminded of what we've all experienced right here: extreme heat, extreme cold, and lack of water and power. And one of the best ways we can be resilient in those times of need is to be as healthy as we can. And so whether it's about, you know, people that just are dealing with chronic disease or dealing with homelessness and bed bug bites, you know, we've got to be healthy. And so the goal, I believe, of Central Health is to make sure everybody can be and live as healthy as they can be. So listen well and ask your questions and give your feedback, because we need it. Thank you very much.
Good morning, everyone. Thank you for being here. Again, thank you. I also want to take a moment to thank our staff. And, you know, this is our 5th community conversation, and they work really hard to put together these events so we can get feedback from you, the people of Travis County, taxpayers, voters, patients, and so thank you, team. I also want to acknowledge Board Manager Shannon Jones, who just joined us. Thank you for being here, Shannon. Okay, so I'm going to talk about our budget priorities for fiscal year 2026, which we are calling the Year of Access. But before we do that, I'd like for you to imagine a healthcare system where every person, regardless of income, language, background, feels seen, supported, and truly cared for. That's the system we all deserve, and that's what Central Health is aiming to do. But, let me see. Here's a little bit of reality. Today's American healthcare model often fails to meet that vision. Patients become checklists. Care becomes transactional. We have a system of care that's really sick care, not healthy care, and about keeping people healthy. Those with the least are left to navigate a very complex, fragmented system on their own. And that fragmentation has real consequences. You have people who are waiting 30 to 40 minutes on the phone, trying to get an appointment to see the doctor. People are filling out forms, the same forms at multiple locations. They are bouncing back and forth between hospitals, clinics, labs, x-rays, pharmacy, and shelters, and falling through the cracks. It can take weeks or months to get the right care. And these aren't just inefficiencies, they're structural failures that delay care, worsen outcomes, and erode trust, especially in communities that are low income and uninsured. It's unacceptable that in Travis County, geography is destiny, where someone living east of I-35, likely a person of color, can die 10 to 20 years earlier than someone living in the west of I-35. So let me talk a little bit about Central Health and our system. Central Health was created by voters, as many of you know, to address this very problem of the health inequities that exist in our community. We are charged with building a better system for those who need it most. We're not just another provider. We are the public hospital district for Travis County. We're funded by and accountable to local taxpayers like you. And we're uniquely positioned to lead because of that public funding that allows us to invest in what matters and helps our community. We have strong public support. 90% of residents believe healthcare is a human right. We have a robust and trusted primary care system in community care, which you'll be hearing from here shortly. Community care handles more than 500 visits per year. 500,000, sorry. Thanks, Ted. 500,000, 500,000. We have a broad network also, which includes 255 provider locations. This includes all of Community Care's health centers, People's Community Clinic, Lone Star Circle of Care. We've got hospitals, other specialists, dentists, urgent care providers, and we also have Sendero health plans as part of our system, and Sharon will also be speaking here shortly. Sendero allows us to meet the coverage needs of people in our community, and we're doing some great work with them. So together we are focused on seamless care, connecting people to care on their journey from cradle to grave, and we're also building what others won't fill, and these are the healthcare gaps that we're working on. We're going to talk to you about some of those today, but they include medical respite care for people, many of who are unhoused and discharged from the hospital and don't have somewhere to go and heal. As a matter of fact, our Central Health's Medical Respite Center just opened yesterday, and we got an update last night that we have our first 6 patients. Yes. And we're also building out our specialty care for uninsured patients because of a study that we did a couple of years ago told us that some of the biggest gaps that our community is facing challenges in is in accessing specialty care. So we've been focused on that, and we'll continue to focus on that. So here's what we're building. We're building a system where patients are guided through one coordinated system from primary to specialty care with fewer delays and less confusion. A system that supports our care teams that communicate, share information, and care for patients throughout their personal healthcare journey. We're building a system built on trust. We're building a system that fosters better health outcomes, and a healthcare system where every person, back to that vision, regardless of income, language, or background, feels seen, supported, and truly cared for. So now I'm going to talk a little bit about the Year of Access and why we're calling 2026 the Year of Access. For the first time, Central Health, Community Care, and Sendero are planning together as one unified system with shared priorities, shared goals, and shared accountability. Central Health's proposed 2026 budget reflects this historic alignment and a bold new phase in delivering health care that works better for everyone in Travis County. Our Year of Access budget is focused on eliminating healthcare delays so people get the care they need faster, creating one connected system so care feels seamless and not scattered, and we're delivering maximum value by stretching every tax dollar to reach more people. And we believe that when we deliver results, we earn trust from the residents we serve, the taxpayers who fund us, and the leaders who hold us accountable. And so now we want to get into a few details, and so I'm going to hand it over to Tara Trower, our Interim Chief Operating Officer at Community Care. She's also the Chief Strategy Officer. And then also I want to introduce Sharon Alvis, who will also speak in this portion, and she's our CEO of Sendero Health Plans.
Thanks so much, Paula. It is very good to see all of you today. In fact, I see a lot of familiar faces. We've got a lot of folks from partnerships that both Central Health and we at Community Care work with as we try to build a stronger safety net for Travis County. So thank you all so much for being here. We're going to talk about the Year of Access. First, although I know that most of you are familiar with community care, we talked about the 500,000 visits. That's a record for us, year over year for the past, as long as I've been there. We have worked our darndest to increase access in and around Travis County. That includes increases in the number of visits. We've opened, in partnership with Central Health, a number of new locations for primary care, dentistry. We do some specialty care. They've expanded specialty care also. But the fact that we're still talking about access means that we have not expanded fast enough to meet the high degree of need that exists in our region. You're going to hear more details about the budget later. It does include a significant investment by Central Health in the primary care framework that is offered by community care, and for that we are grateful. It's a record investment, but again, it speaks to the need to build capacity in new and creative ways, not just around new brick and mortar locations, but making sure that we are doing the best with the resources that have been provided to us via the Travis County taxpayers. And so, next slide. They all work differently, so I'm never quite sure which direction we're going to go. So Perla talked a little bit about how we're all working together. We're all working together in the most, as collaboratively as I've ever seen, and trying to really fill those holes and gaps in the safety net. And so that's Central Health, Community Care, and Sendero working together. It's easy in some ways because we all share a North Star. And that North Star is our patients. Very much committed to making sure that they have the right care at the right time and at the right place. And so when we talk about how we're going to look at access, we know what it means when our patients don't. Those missed appointments, delayed care, those are the things that lead to those outcomes, worse outcomes that Perla described, that where you live can dictate how long you live. And so when we take a look at the priority, our first, and this is a moonshot, we're calling it for a reason. It's bold, it's urgent, it's meant to stretch us. Our goal, 2026, is to reduce appointment wait times to 2 weeks or less. Any of you who have tried to schedule anywhere know that Austin area is a very competitive place when it comes to primary care offerings, but making sure that people can get in, particularly folks like our patients who have fewer options and are able to get the care that they need when they need it. And so we're going to be piloting some new things. We will be doing a deep dive at one of our largest hub sites to map every barrier that slows access. Like I said, this isn't just about exam rooms. That's making sure that we do warm handoffs, connecting folks to care so they don't miss appointments. It's looking at the ways that we use things like telehealth and virtual health to shorten that time to new patient appointments so that we can get the folks who are moving to our community in the doors and new patients to make sure that they have access to consistent care, they can stay consistent with their care plans, and they are living their best and healthiest life. Because getting care when you need it shouldn't be the exception, it should be the standard. The next element of our patient-first agenda, if you will, is reducing avoidable readmissions in emergency departments. And you may say, why are the primary care people talking about the emergency department? Again, it's because it's all connected. Those delays in care, that not being able to have consistent access, whether or not you are a recipient of Medicaid, whether or not you're on Travis County's medical assistance program, those ups and downs and those delay in care can ultimately mean unnecessary trips to the emergency room. It can mean additional expense and hardship for families who weren't able to get what they needed when they needed to it. And a lot of that has to do with chronic care. When you think about our patient populations, we have a lot of hypertension, we have a lot of diabetes, we have a lot of what the MDs, and I am not one, talk about metabolic disorders. These disproportionately affect our patient populations, and these are some of the things that, if left untreated, drive these undesirable outcomes that keep people out of work, out of school, early mortality. When we talk about our pregnant women and moms, making sure that they are healthy for the duration of their pregnancies. And so really digging deep to avoid readmissions. This includes these handoffs to care. We've got a number of intensive, what we call intensive outpatient care programs to make sure that when folks leave the hospitals, they get the care and support that they need. Perla talked about the respite center. That's a lot of what that is intended to do, to make sure that the benefits that they receive, if they do need a hospital stay, can stick, because they have a place to rest and heal and not have, I think what Dr. Lee talks about, this cycle of death that happens particularly for our unsheltered patients. So we will be working, went forward one, with our partners both at the hospitals and other sites, and partners like many of you are represented in this room, to help make this more seamless, more coordinated, and hopefully stop that cycle in the years to come. The next of our priorities is increasing the number of unique patients with coverage. Again, you're probably wondering, why are the primary care people talking about coverage? And we're going to hear from Sharon Alves at Sendero in just a minute. But coverage, and that is both insurance and the medical assistance program, which isn't insurance but acts as it for those individuals in our community who don't have access to insurance for whatever reason. Coverage is one of the biggest predictors of access and dignity in healthcare. If you don't believe that you can afford a visit, you're much more likely to delay. You're much more likely, like some of our moms, to prioritize your kids over yourself, which then can have tremendous consequences in terms of your ability to go to work, care for your families, both children and elderly parents. And so making sure that patients have coverage the moment that they walk in the door is really, really critical to the progress in making the change in this year of patient access. And so we're working to identify patients early on, the moment that they reach out to us, whether it's in our call center or with our community health workers, our outreach folks on the ground, to connect them with Medicaid or Medicare if they're eligible. If they're not, screen our residents for whatever grant programs or medical assistance program that might be to qualify them, so that they have that confidence that then when they walk in the door, that they can receive all the care that they need and deserve. But we are going to let the health insurance folks talk about what else coverage looks like as part of the system in Travis County. And so I'm going to ask Sharon Alves to come and join us, CEO of Sendero Health Plans.
Well, thank you very much, Tara. That was really helpful information. And thank you again for being here. I'm going to talk a little bit about Sendero and what we've done in terms of growth. So in 2023, Sendero had about 6,000 members. In 2024, we doubled that to 12,000 members. And in 2025, we have almost 30,000 members within Sendero. So we've grown it quite a bit. What that allows us to do, because those premiums come in through the ACA product, that allows Sendero to be in a position to work closer with Central Health so that we can serve more of the MAP members. We have a program called CHAP Expansion, and that allows for Central Health to pay premiums on some of the sickest of sickest members, and therefore Sendero can bring them expanded benefits that are available within an ACA product that would not be available in the MAP program. Things like CAR T-cell therapy and some high expensive services that we make available. And so currently in this last year, with our increased volume to 30,000, we've added almost 200 members to that plan. We went from 700 to almost 900 in the CHAP expansion. We also work with Central Health on a program we just call CHAP, not the CHAP expansion. And in this one, we are serving almost 2,500 members. And this includes programs in affiliation with HAMS and the SIMS Foundation, where we work with them to take care of part of that population. And again, we work with Central Health because Central Health partially funds some of those services for us. We also are working continually to seek, so within Sendero, we're seeking other ways to reduce expenses. In last year, we reduced our administrative expenses by 12%. which is in a health plan, you're only allowed to spend 20% or you're penalized. So we reduced it from what was more than that down to 12% last year. We were very proud of doing that. Sendero also, by the way, holds the distinction in the state of Texas of being the only ACA plan that carries a 4-star rating in the entire state of Texas. And we, by the way, we've held that for 4 years running. So it's a real initiative, and one of the reasons it's successful is because Sendero really has, and the team that's at Sendero and has for years, has an incredible focus on compassion and on caring for the population, and they work really hard to do that. So in addition to these things, we're also working to expand and seeking other sources of revenue for Sendero so that we're not totally into the ACA. We're going to expand some of our capabilities and look to better position Sendero to be a greater partner with Central Health and with CUC in the process. And so we're consolidating services across the enterprise that where we have duplication, we're bringing those into a central, and we're working really closely to pull that together. So with that, I'm going to turn it back over to Tara. Thank you.
One more slide for me to talk about, there we go. So I think someone who went before me, I think it was Commissioner Howard, talked about not just having access, but making sure that we are delivering on the promise of high quality, excellent care. Although we recognize that our patients do not have as many choices as others due to their income or lack of insurance, we want to be the place that they choose to go, even if they had other choices. And part of what that excellent looks like, and one of the really fantastic things about community care being part of an FQHC, is that, or federally qualified health center, is that we are required to measure and report. And so we know whether or not we are delivering the highest standard of care. And so this year we are going to pick 3 quality measures. We have not selected them yet. Last year we worked really hard on colorectal cancer, as well as vaccines and some other screenings. But we as a system, which includes a health plan, includes Central Health, are going to pick 3 that we're going to track together, because we know, we saw that chart about how people move through the system, to make sure that we are doing everything that we can, whether it's at the stage where we are in primary care, whether or not you're in acute hospital setting, and when they leave, whether it's respite or what we call post-acute care, to make sure that we are all accountable and responsible for those quality measures, and that we are tracking and improving each and every day. And so with that, I think Ted is going to come up here. We promised that this would be engaging and not just us talking at you. We want to hear from you as well.
So this is a chance for us to hear from you. We have a couple of questions that we want to put up and ask you to respond to, but of course we're not limited to these questions. But first, based on what you've heard so far, what might make it easier for you or your loved one, your family member, your neighbor, to manage their health after they visit the doctor's office? So think about your personal experience. Perhaps it's the experience of an aging parent. What are some things that we could do, the Central Health system could do, to make it easier for you after you leave the doctor's office to continue to manage your care and to continue to live a healthier life? And I'll open it up for anybody who might have some thoughts on that. And I will come to you. There she is. Now, don't tell that joke that you told earlier. She had a really good joke, by the way. We'll save that till later. What would make it easier for you?
Good afternoon. My name's Sherry Taylor. I noticed the word she just used was federal. If this is a federal program, I happen to be a 100% disabled veteran. If I go to any facility, when I change it in that location in Maryland or Texas, it's changed everywhere. So if this is a federal program, maybe you could have it changed everywhere, so the person goes to a service, they don't have to go here and go here and go here. If it's changed at East Austin, it's changed at West Austin. And then when the person goes back for aftercare, they don't have to go find which piece of paper, because it's changed. So if you federalize your communication system, if a student or an elderly person or somebody who's a caregiver changes it once, it's changed everywhere.
And I think this actually hits right on what, Perla, you talked about in the very beginning, which is creating a more seamless system of care so that, I don't know about you, but I've been in that situation for an aging parent where you go to one doctor, you fill out a bunch of forms. You go to the next doctor, you fill out more forms. And so it's as if the doctors, the providers, the clinics aren't speaking to each other. Have y'all experienced that before? So who from my team would like to talk about what we're doing to address that? And Tara, I was looking at Tara like, who from our team? I think it's the lady in the green jacket.
I've got a mic. So when we talk about, to your point, in recent years, we have done some substantial investments, including investing in Epic as our EHR, which has the benefit.
EHR is?
Electronic Health Record. For those of you who've used it, it enables the patient to use MyChart, an application on your phone, and you can see all of your visits. A number of other medical groups here in town, it's one of the largest. We are also working with our partners who do not use Epic to make sure that we've got that ability to transmit information so that they can see the record as well. So to your point, you don't have to carry the paper with you from doctor's office to doctor's office. And so there are a number of other things that we're working on, but I would say that that's the biggest one. And then working with Ascension and St. David's and a number of the other partners here in town to make sure that that access is seamless so that we have it in the middle of the appointment so that your provider, no matter who you're with, has the most up-to-date information all the way through the medications you're taking.
And Tara, as a follow-up from somebody in the audience, I think it's in the audience, it could be on Facebook Live, what are we doing to ensure that appointments are at the same location, if possible, and if they can't be, if somebody has to move from one facility or clinic to another, how do we assist or help with transportation?
So that is a multi-part question. When it comes to locations, we have some locations like our North Central hub site that are very, very popular and is very, very beloved. We are working to do our best to make sure that we have access at all of our sites, but some are more challenging than others, although we're working with our planning teams at Central Health to try to figure out solutions to that. I also mentioned telehealth earlier and finding ways to, when you don't need a face-to-face appointment necessarily, to have that appointment with a provider via telehealth, which actually also creates access for your PCP, for those folks who really do need an in-person visit to see their assigned primary care provider, to be able to do that. Community care is accredited PCMH, patient-centered medical home, and it is one of the things that we are graded on to make sure that there is that connection to care. That said, we are also working on open access. We understand that sometimes you just need to see someone. I know as a mom myself, you know, when the kid has an earache, I actually don't care who I see. I just need to see someone right away. And so these are the things that we're trying to balance as we build out healthcare access. One of the other questions, if I remember correctly, I'm going to have to start taking notes, has to do with transportation.
Yep.
So
Which is one of the greatest barriers to accessing healthcare, correct?
That is one of the biggest barriers, particularly in our community. We do have mass transit, but it doesn't always get us to where we need to go in a timely fashion. And so we have a number of, we do provide bus vouchers, but we also have partnerships, and I believe the entity just signed an agreement so that all three of us now have access to the same provider. I talked about Epic, our electronic health record. Our folks at the front desk, our folks at the patient navigation center have the ability to schedule you a Lyft ride to get you back and forth to your appointments. And so those are some of the ways that we're trying to address what we call in the biz social determinants of health, and those are all the things that just make it even more challenging to access healthcare.
And a follow-up, this is a good question regarding MyChart as an app, but what about people who don't have access, easy access, right, to a mobile device or a computer? How can we help people, those people, also easily access their records, make appointments? And I mean, is there a phone number? What's the more old-fashioned way, I guess, of accessing? Sorry, I'm talking to myself there, not to anybody in the audience.
I'm going to embarrass myself, and if Gail Finazzo, who's head of our Patient Navigation Center, is watching this, I'm really, really sorry. But to call a Patient Navigation Center.
Yep.
They have we call it our 311. They're able to help you not just with the scheduling of appointments, but making sure that you get what you need, including if you have some additional needs to make sure that you have access and they can get you to your provider.
Thank you.
I'll get the number to you later after I look it up on my phone.
Okay.
With a question.
I have several questions. The first one being, the last time I was in one of these, I was hotter than a firecracker because I have a friend who's blind, 72, living too far from family. And I wanted her over to where I am. She won't move because she don't have access to your medical center. Why is it that if you look around now, we, the matured bunch, we're here and we need access like everybody else. I understand that pregnant mama needs access. I understand that baby that broke his leg. I do understand that, but somehow we have been forgotten because well, I hear that so much. If somebody tell me that again, I'm gonna shoot them because I see that every morning when I get up. What happened to medical? How do we get y'all back to seeing us? How do we not have to, if I don't have family and I get sick, you gonna tell me to talk to that girl on the phone, and she gonna say, how can I help you? What do you want? Press 1, press 2. She's not here. One more time. And if I could get her, I would pull her, I would strangle her because IA does not work for everybody. I had sinus infection last week. I called my doctor, she was on vacation. I love that. I still had sinus infection. Nobody could see me. My head was running around doing this thing and my body was on the bed. You guys have, I have issues with y'all treating us. Us mean, if I say it, I'm gonna shoot my own self. Older people. So if I have a heart attack, I live in Maynard. If I have a heart attack in Maynard, you know, there's this little shot that, you know, you guys can hit me and I'm gonna make it. By the time you get on the 290 across from where you are, I'm already saying, hey, God, or hey, dude, I didn't mean I come down here. Because I'm going to die because we have no access. Just because I live in Maynard is because we're out there and we're in different places. And I want to know why is it that our access is different. Like I said, I know that the world isn't around us, but we're still here too. So how do you keep us healthy? I mean, I know we're old and we're moving a little slow and all that stuff, but we're still here and still active and we still need medical care.
Yeah. Can I speak to that?
Yes, please.
So we acknowledge that care across our community is not the same. One of the areas that we are investing in, and one of the, frankly, really important things about our partnership with Central Health is that we do have the ability to care for more than just the moms and babies and kids that is traditionally the space of a federally qualified health center. That said, when we talk about the year of access, the one area where you're probably the most challenged is what we call new appointments. Our access, although it can still be improved for those folks who are already in our system, those wait times are much shorter, and one of the areas that we will be investing in and have already started this year is how to take care of issues just like the one that you described with your friend, that they need care, either they were on Medicare and were dissatisfied with their provider and want to come back to us. We want to retain our existing patients who reach that threshold of 64, 65, and they suddenly have access to care. We've developed a pilot program around Medicare well visits, and in some of the programming that we're talking about, specifically at Colony Park, I know it's not Manor, but taking a look at those in our community who are aging, I'm not super young, but are staying in place as they enter the next phase of their lives so that they can have that access to care that you just described. So it's imperfect, and I'm not going to pretend like it's not, but it is very much on our minds at Community Care on how to do a better job of care delivery specifically for your demographic.
Let me try and answer your question specifically. So I'm part of the Board of Managers. I live in Manor. I understand exactly what you're talking about. Even if you wanted to get into town, 290 is not going to allow you to get there. And unfortunately, one of the things we're seeing for not only Manorites, but particularly for those of age, of which I'm part of that population too. I may not look like it, but I is that we need to talk about diversifying of services provision. Tara spoke particularly about what historically Community Care has done for basically women and children, primarily those who are younger. That's not all they did, but that's what primary. We're looking at what strategies we need, what programs, what populations we need to serve. Central Health is the entire agency, oversees all of these activities. So the purpose of this meeting and other meetings we're having is to hear exactly what you're saying. So what I'm hearing you saying is we need more services that focus in, have accessibility for those who are of age. And so that's one of the things we'll take back. We do have clinics in Manor, but we don't have the ones that we need to. So one of the things we'll look at, I'll be pushing for, is do we need to put more comprehensive services out in that area? So thanks very much for your comment, and rest assured, as a Manorite, I'm going to be on top of it.
I'm going to try to address some questions that are coming in via our texting platform. There's a question about the transportation program. Yes, we still work with Lyft. I think it's called, say it out loud. Motive Care. We have 2 full-time staff people that all they do now is book appointments to get people to and from appointments. Yes, we do track where clients are coming from and going to, so we can better model our care after where people live and where care is needed most. There's a question about reducing wait times. Tara talked about that. That's very much on our mind. In fact, it's one of our 2026 priorities, Year of Access, is reducing wait times from the time you make your appointment to the time you see a provider to less than 2 weeks. So that is one of our goals for next year. There are some other questions here that are a little bit technical that we will answer and share with you after this meeting is over with, but there's one I think we can answer quickly before we go to the next question, which is regarding how do we bridge the care gap for people who are unhoused. So somebody who doesn't have a place to live, may not have a mobile device, may not be able to do a telehealth appointment. So I'm going to ask my colleague Cynthia Gallegos to stand up and help me answer this question. Thank you.
Hi, my name is Cynthia Gallegos. I'm VP of Operations with Central Health. And to help address the question specifically around individuals that may not have a phone, specifically those that may be experiencing homelessness, Central Health launched a loaner phone program a couple of years back, and we've piloted it and we've slowly started to expand it, but in its highest level, it's currently catered to those who are experiencing homelessness. When they are seeing one of the providers in the high-risk population space or in our transitions of care space, if they are identified as needing ways to communicate in order to continue to bridge the continuum of their care, they are oftentimes, prescribed a phone through this loaner phone program, so that the teams can continue to monitor them, connect with them, and ensure that all of their needs are being met in order for them to meet their various appointments and anything that might be related to that.
I'm going to take one more question here, and then we're going to move on and get to the actual budget, and we will take more questions as we go. Sir?
Okay. Well, my name is Gavino Fernandez, and welcome to all of you to the barrio. I'm a lifetime resident. I'm currently Democratic Precinct Chair for 402, and I want to thank y'all for looking at reducing the gap of wait time. As you well know, I've always raised that question of 6 months turnaround. Now, the other issue is, what are you doing to provide mental health care? You know, where is Intercare? When are we going to bring Intercare into this discussion? I work with 3 homeless Latinos from the barrio, 2324, who congregate against along the day camps, the homeless day camps, because they also go and get their drugs. So I try to get them access to information for care, and it is very, very difficult. So I too was part of when the whole thing started, and I was against it because I knew we were going to have these kind of issues. But moving forward, I look to see the day in 2026 where they can get an appointment in 2 weeks. And so, again, I commend y'all for doing that. And I also want to mention to you that before we leave here, I want to make sure that everyone that is eligible is registered to vote at the current address, okay?
Is that what the T-shirt stands for?
Yes. It says, register with me. Okay, if you moved from A to B, you need to register again. You can also go online. But that was my spiel, and thank you.
I saw it when you came in.
It is very, very difficult for our constituents to have trust and belief because of all these denials. And I'll stop it there because I think that, we were on the court when the clinics went from the county to FQAC. So anyway, I'll continue to work with y'all.
Thank you for being here, and also thank you for always holding us accountable, because that is your job and our responsibility.
I'm going to try and take your question. My name is Susan Dubois. I'm the Interim Chief Medical Officer for Community Care Health Centers and a practicing endocrinologist here in town. So the continuum of care for mental health is not unlike the continuum of care for other illnesses. And so we work with our partners to make sure that everyone has their needs met. At Community Care, we have a primary behavioral health medical home model, so patients can see a behavioral health consultant or a psychiatrist in the context of their team-based care. So they may come for their diabetes appointment, but they can also see the behavioral health counselor. Now, you have different needs in the intensive outpatient spaces. So such as you talk about people experiencing homelessness, we have enhanced mental health providers within those intensive outpatient teams. So they have a higher number of counselors and psychiatrists that work right in that team, some of them that go out to, the streets to deal with them. Do we need more? We absolutely do need more. One of the things at Community Care that we're doing this year to expand access to care is something called the collaborative care model. And that's where a psychiatrist can do consulting work through case managers that will communicate with both the patient and the primary care provider to help them get access to this specialty care. So the psychiatrist doesn't need to see every patient individually. The care manager monitors that patient through a registry and makes sure they're meeting their goals and does the communication back and forth. So this is a complex problem, and it takes complex solutions, but we're working together with partners and our partners at Integral Care to make sure everyone gets their needs met.
Have you ever looked at creating a mobile clinic? Go into the body, go into the clinic, just like a library clinic, this is a mobile clinic.
Thank you for asking that question. You know, I'm Ann Kitchen. I'm on the chair of the Central Health Board. I also sit on the Integral Care Board. Integral Care has recently, and we have another board member over here from the Integral Care Board. Integral Care has recently started a mobile van. So very recently, and we plan to expand the mobile van access. So thank you for asking about that. Happy to talk with you more about what you see as the needs for that. And then I just want to say from a Central Health perspective, from a policy perspective on the boards, we recognize and support mental health and physical health services. You just cannot separate that. You know, and we all know that. And so we have many partners in the community. You heard from Community Care and the great work they're doing. Integral Care is another partner. We partner with others in the community because we want to make sure that when we talk about access, we're not just talking about access to physical care. We need access to mental health care also. Thank you.
We're going to move on to get to our budget. Do you want to add something, Sharon?
Just along this same line, Sendero has created a new program we're calling Mental Health Matters, and it's a whole program being run by a psychiatrist on our team, and we're looking to how do we maximize that, how do we make certain every member knows that they have access, so we all completely hear what you're saying, and there's none of us with Central Health, Sendero, or CUC that doesn't recognize exactly what Ann Kitchens just said, is that mental health and physical health cannot be separated. You have to treat the whole patient, and that's what we're about. So thank you.
These are really great, important questions, and we'll have more time for other questions as well. But I want to just spend a moment to talk about our people, our employees at Central Health. Without them, care is not possible. At Central Health, we know that a strong workforce is the foundation of a strong healthcare system. And that's why we're focused on creating the kind of workplace where people feel valued, supported, and aligned around a shared purpose. And this year, going back to our priorities for fiscal year 2026, we're setting a baseline for satisfaction across our entire system through surveys and focus groups with employees. We're not just stopping at data collection. Every department will be expected to complete action plans based on the feedback we receive, and we're setting the expectations that those plans lead to real change with our patients. It's one thing to ask people how they're doing, but it's another to show them that we're listening. And so we know that when our team member satisfaction result is high, patient satisfaction and quality is also high. So again, just wanted to take a moment to talk about our people and acknowledge their hard work. All right, and now we're going to talk about the budget.
Hello, I'm Nikki Riley. I'm the Deputy Chief Financial Officer. Here comes the exciting part of this presentation. So, more access to care, less wait times, all of this costs money. And so we have really scrubbed our numbers, and for fiscal year 26, we have prioritized these objectives, and it is our job to make sure that every tax dollar that comes in is used to the best benefit of what our mission is at Central Health, CUC, and Sendero. So, one of the things I think a lot of our theme this year is we're really working together. CUC, Sendero, and Central Health, it's the first time we did our budget together. We are working together. We're really trying to find ways to be more efficient in what we do. CUC had an eligibility team. Central Health had an eligibility team. We're now combining those to make sure that we're making one effort. There's not redundant operational inefficiencies. So we've really taken a close look at that. There's definitely more work to be done, but we're already seeing that we can do more with less when we do that. And so a lot of that has already taken place, a lot more to do. Eligibility, our transportation contract that we just signed is for all three entities, which I think that's great, because when you have more to contract with, you get a better deal. And so as Deputy CFO, that's what I get excited about. And there's other ways that we can also try to be efficient. And so that's kind of our job this year, to just make sure that we're being good stewards of taxpayer money. So this is some of our budget highlights. Of course, it would happen to me. Okay. So this is some of our fiscal year 26 budget highlights. In fiscal year 26, our total expenses that we have budgeted are $544 million. That's an increase of $51 million from our budgeted expenses of $493 million last year. Healthcare delivery is really the largest part of that increase at $68 million. Purchase services, which are healthcare delivery, healthcare services that we purchase outside, like CUC, Lone Star, People's Clinic, we're increasing that $40 million.
Nikki, Mike, will you explain what you mean when you say purchasing healthcare from Community Care or Lone Star, just for people who may not be aware of what that means?
So in 2019, it all changed for us, but before then, Central Health wasn't allowed to provide, or I say allowed, legally allowed to provide health care themselves. They had to contract out with local partners, Community Care, People's Clinic, Lone Star, and a variety of there's multiple vendors that we
hundreds of partners.
Yes, to provide health care to Travis County citizens. In 2019, there was a change in the legislature that allows us to provide health care directly now. So we're actually employing doctors. That was a huge change. And that was really the kind of the jumping board off of our strategic healthcare plan.
Nikki, if I could add,
Sure.
The other thing to remember is that we collaborate in the community with many healthcare partners, We will continue to do that. We are continuing to do that. One of the things that's really important to us is not to duplicate services and not to step in and add services where other people are already doing them in the community. So the purchase services are the kinds of things where we're working with people in the community, like Integral Care, like Peoples, like Lone Star, et cetera, so that they're already doing those services. We're not going to build those. We're not going to provide those directly, but we're going to work very closely with people that are doing that. Direct services, as Nikki said, is we saw a whole lot of gaps in care. And what Nikki is talking about is, so we now have the ability to directly provide services to cover some of those gaps where other people in the community are not doing so. Thank you.
Thank you for that.
People's Clinic is not accepting people anymore. Say that again? People's Clinic is not accepting new patients. People's Community.
Which I think also drives home the need for central health. There are huge gaps in our community, and I think that is one of the reasons that you'll see in this budget that we are increasing the amount that we are spending to expand access to care, because that's the harsh reality. There aren't enough appointments in our community, whether it's primary care, specialty care. That's why we're working with Community Care and Sendero to expand access to people who need it most in our community.
Thank you. So our direct services, I think somebody pointed this out, we are mainly focusing on specialty care. So the majority of our doctors, well, all of our doctors right now are specialty care doctors, and we rely on our partner, CUC. It's our largest investment in primary care. But we have to work together, because you go see a primary care physician, they're like, oh no, you need to go see a cardiologist or a pulmonologist. And so we're working on being able to quickly navigate the patients from CUC to our specialty care clinics. And the more we invest in that, the more budget we use. We can hire more physicians. We can provide more, expand the services so that we create more availability. Our administrative costs increased $9 million. This is all the back office. We are investing in our technology. Our EHS, which electronic healthcare.
EHR.
Thank you.
Electronic healthcare record.
Electronic healthcare record, that is not inexpensive. And so we're using that to help talk to each other electronically, which is a lot faster than calling somebody up, emailing, and so that's working out really, really well. Both CUC and Central Health use Epic, and so it's really helped streamline that process. We also are a healthcare agency, and so there's a lot of private information that we carry. And so we are investing in our infrastructure to make sure that all of our patients' records are kept safe. Also, we are a service company, and so our assets are our employees. That's what we invest in. And if we have happy employees, you guys get better service. That's how that works. And so we really want to make sure that our employees are happy. And that means a lot of different things to a lot of different employees. So we strive to make sure we understand what makes them tick, why they're here. A lot of them are very mission focused. And it's not about the money. It isn't about a lot of stuff. It's just that they love working for Central Health because it gives them a sense of purpose, and that is their mission as well as it is ours.
And I think what Perla said is really important. There's a direct correlation between employees who are motivated and mission-driven and patient care. And as a government entity, a taxpayer-funded entity, that's where That's our bottom line, is making sure that we're improving not only the quantity of care, but the quality of care that our patients are receiving. So just like anybody who has a Cadillac insurance plan and can see the best doctor perhaps in the country, our patients deserve that same quality of care.
So we have a line in our budget called Other Financing Uses. Basically what that is it's movement of money to either fund some capital projects or to fund our reserves. We did create a new reserve this year called the Public Health Center Reserve. It's $12 million. There's a lot of risk in the healthcare industry. It's complicated to figure out any money that you're going to get from Medicare, from the feds. And so we just want to make sure that we have the ability to cover things that are unexpected. So that's what that $12 million is for. And we also have a policy on our emergency reserve. When we increase our expenditures every year, we take 15% of that and put it into our emergency reserve for, you never know what's going to come up, like COVID, right? So that's what that's for. So where is our money going to go specifically? We did a presentation to the Board of Managers a week ago, and these are some of our highlights on more specific things that we are investing in. Like I said, we are increasing our purchase services, which is our third-party contracts for providing care. It's mostly primary care, but it includes dental, definitely spending more money on mental health, and also substance abuse treatment. Integral care, like Ann says, is a huge partner with us that helps us take care of that. We want to optimize and stabilize our direct practice services, which we really just started in fiscal year 24, so we only have a couple years under our belt. And so we are taking a look at what we're doing, what we've already set up, and making it better. We're expanding that care. We're hiring more providers, so that creates access for more patients to be able to get in and decrease waiting times. So there's some of the specialty care specifics: pulmonology, rheumatology, gastroenterology, nephrology, ENT, the ear, nose, and throat, cardiology, endocrinology, and dermatology specifically is what we're investing in next year. We're also, you asked, sir, about the mobile units. We're investing in 3 more mobile care units to be able to go out to the unhoused and treat them on the street. That has been extremely successful, and it does have a huge mental care aspect to it. So we are also investing in 3 more psychiatrists, which we talked about earlier. We are adding eyeglasses, dentures, and hearing aid coverage. We're also expanding our patient transportation services, which you also heard about. And then also our ambulatory service center, anesthesia. You would not realize how hard it is to get an anesthesiologist on staff, but it is. Very difficult to contract with. Oral surgery, specialty dental services is going to be a big part of our new clinics. Infusion programs. We're also, like I said, going to improve the network infrastructure, our cybersecurity. And one of the things we're really, really involved in right now is looking into AI technology. Really a directive from our CEO, figure it out. What are y'all going to do to make things better with AI? But we have to do it cautiously. Want to make sure that we're doing it to make sure all your information is still adequately secured. But one of the things I want to talk about, which has already happened, which I thought was genius, is Sharon Alvis at Sendero. You want to come up here and talk about what you did?
Thank you very much, Nikki. Am I on? Real quickly, because I think we're running a little behind, but Sendero has taken the initiative to sort of be the front runner out on the AI, and we brought in a call center AI assistant in January 15th when our volumes went to 30,000 from 12. Increased our call quite significantly, and we brought in an AI assistant, was just incredibly resolved our problems. We also have done something where we have an AI system that is generating letters for our medical management team. They do about 400 letters a week for proving prior auths, and the system merely creates the letter and faxes it for it, and the fax doesn't go through it, repeatedly fax it, and it stores it in the system for us. So when we did it, the staff was thrilled. It was just such a load. It was taking them 40 to 50 minutes per letter. And I've only got 4 people in that role, so it was an incredible effort to do that. And we're also working, we talked about eliminating duplication across the system. The transportation system has been talked about. We do have a single vendor that'll serve all 3 entities, and it does give us a reduced price for the vendor services. And we are other examples where we're working to incorporate credentialing. We're looking at how do we create credentialing across the system. All 3 entities do that. We're all doing it separately. Can we bring those through, not duplicate the software systems? So there's an incredible effort. We're also doing some work with Central Health on utilization management. We're providing some services to them. So we're going to bring all these services together so that we are a whole lot more integrated system, and AI is just one piece of it. So I'm going to turn it back to Nikki. Thank you all.
Thank you, Sharon. I'm going to go on. So we are a governmental entity. So this shows you just how much of our money does come from Travis County taxes. Revenues are on the left for fiscal year 26. We have budgeted, we're estimating that we'll get in $424 million total. 90% of that comes from taxes. So you can see how reliant we are on taxes. We are doing our best and have a conscious effort to try to get funding from different sources to relieve the taxpayer burden. And so we are actively looking for grants. We have a couple local grants that are coming in this year as well that we'll be utilizing. And so we've hired a grant writer. We are actively looking for whoever else will give us some money. And then, as you can see on we have $544 million budgeted for expenses this year. 77% of that is going to healthcare delivery. This is our proposed tax rate. We are asking for 8% over the no new revenue rate, which is an increase in taxes. Our last rate was, I believe, just under 10 cents. We're asking to raise it about a penny. That will get us new revenue to be able to invest in everything that we know is needed and has been asked for.
Nikki, will you explain what the no new revenue rate means?
Yes.
So when you say 8% over, what that means?
Yes. It used to be called the effective tax rate. And basically, the no new revenue rate is the rate that would get you the same amount of revenue that you got last year. And so we need to be able to invest in more than that. The only new revenue then that we get is the new construction. So when there's new construction in Travis County, that's new revenue that comes in. That's really the only way to get new revenue from taxes. And so what the 8% represents is 8% over the no new revenue rate to get a few more dollars so that we are able to invest in what we know the community needs.
Thank you. And I think it's important just to remind what Tara said earlier. Community care served more people than ever last year, 500,000. Central Health funded care for more people than ever last year at 155,000, I believe is the right number. And so the demand is only going to increase. We know that. There's uncertainty at the federal level, the state level, but people still need care. And so regardless what happens in Washington or what happens at the Capitol, we have to be there for our patients, and that demand is only going to increase. And the uncertainty really just, and you talk about this very eloquently, about Central Health has to step up and be there for the community.
Thank you, Ted. That's a good point. So this was presented to the board a week ago. It was before we actually got our certified tax roll, which comes from the Travis Central Appraisal District. We now have that, and so I can kind of provide a little bit of information on if it goes to 8%, how much that would be for the average taxpayer, and it would be approximately $64 a year. Any more questions on that? I know.
I didn't hear the question, sorry.
The UT payment, is that what you're, the $35 million, it is in our budget to pay it. Let me see if.
Wait,
Yes.
Andy, you want to?
Oh, I'm sorry.
I can speak to Nikki. Nikki, I can speak to
Okay.
that. And we can talk more about it in more detail, but it is in the budget. As you know, it's something that we're required to do. But what I want to say about it is a couple of things. We've been working much more closely with Dell Medical over the last year to provide more information and more transparency about the work that they do. They do an incredible work with us to make sure we have the doctors that we need to serve people, and their doctors and their medical students actually work in the clinics directly with our patients. And we also have been working with them to provide more information to us on exactly what the $35 million goes to. So for example, we've been working with our county commissioners and with Dell Medical to provide the information about, well, what is the $35 million spent on, which is important for all of us to understand for accountability. But I want to tell you that we have increased our partnership with Dell over the last year. We have focused with them more on being directly serving people in the community. We're happy to talk with you more about it afterwards. Thank you.
But when does it end, the agreement?
I forget the year.
Oh, I don't know.
It's,
When does the agreement?
It ends in about, it's a number of years still, and I'm not remembering the exact year, but it's after 2030. So.
We'll get back to you with the exact year, yeah.
I think in the handout is the actual budget by line item.
Yep. Yep. We want to now invite you to invite your questions and maybe think about this specific question regarding the budget. What specific information or reporting would help you feel confident that your tax dollars are being spent responsibly and transparently? What can we do better to help you feel confident about that?
I'll just ask from here.
Well, no, it's on Facebook Live, so I want to get the audio.
I just want to follow up on what the gentleman just spoke to about UT Dell. My primary care doctor is in residency at UT. I was not able to message my doctor through the portal. I was told that that's true for all patients at Southeast Community Care that have a primary care doctor that is in residency at UT. I'm having trouble getting a straight answer about that But if it's true, I don't think it's fair, okay? I don't know why patients should be at a disadvantage because their provider is at UT. Also, there was a power outage at Southeast, so they scheduled a telehealth appointment for me. Something happened and I was dropped and they told me I missed the appointment but long story short, I missed the appointment. Then they asked me, would you like to reschedule or would you like to change primary care providers? And I said, well, can you tell me when the next appointment is available for my current provider? And I was told that because she is in residency at UT, they didn't have a calendar yet of when she would be available for me to make an appointment. And then I asked, well, when will you get the calendar? And I was told, we don't know. So you're asking me to make a decision between starting all over again with a new provider or in some undefined time frame of making an appointment. And so I'm kind of following up, and I'm sorry I missed your name, but the gentleman who just spoke, look, the relationship with UT Dell, to me, there's no reason they can't be more transparent. I watched the last meeting, Dean Lucanetti, I don't know if I'm pronouncing that right. I mean, it was a full court press about how wonderful UT is and everything they do, and I'm not one of these people saying that UT Dell shouldn't be involved. But I think it really, they're not being good stewards of the money. They're not being good citizens by not being transparent and by not basically trying to fulfill the goal of healthcare equity. I don't feel like I should be at a disadvantage because my provider is from UT.
Thank you, and I'm sorry about your experience. I don't know if I have...
Okay, I'm not here to elicit sympathy
for
myself.
That's...
I'm here because my experience with UT Dell, and I was there as a patient too, has been incredibly negative.
Okay.
Okay, so I mean, it was hard for me to sit there and watch the meeting and just stomach this sort of, and I'm not blaming the dean. I think there are things that go on as a patient that people at the top and the leadership don't know about.
Right.
In the treatment that I had, eventually I was asked to leave UT Dell and never come back. I still don't have a diagnosis. My condition is worse. I don't know where else to go. And they told me, we're done. Leave, don't come back here.
I'm going to get your contact information, and I'm going to also let Tara address your specific question.
So I can answer, and we do, I oversee our patient experience team, and so would definitely like to get your contact information so that we can kind of walk through the experience at Southeast and what we might be able to improve with the residency. I'm not equipped to really speak on the overall relationship with Central Health, but I do want to get back to you, and we will if we provide your information.
Does anyone know if that's true or not? In other words,
Microphone for the live stream, please.
Coming.
Whether or not...
and then I know there's a lot of other people, I don't want to take
No, and I think the answer's going to be, we don't...
Okay, I mean, I just wonder, you know, yes or no, is this the situation for community care patients at Southeast? Their providers are in residency at UT. Not everybody, but a lot of people. Do we have access through the portal to our primary care providers? And eventually mine was added, by the way, and I appreciate that. But I just mean as a policy. Is it normal for people to not be able to do that or to do that? And I don't know if anyone here knows that.
I will need to get back to you on the specifics on how we connect we do have a lot of turnover. We have new ones each time, and so I believe there's some manual things, and it sounds like yours was added. So let me take that back and work. I think it may be a process improvement opportunity.
I have a question, and this might, one of our Board of Managers might want to help address this. How are we balancing our rate increase with the rate increases that will likely be proposed by City of Austin? So how are we balancing all of these different, really, needs of the community?
We are in communication with with our partners in the community, the city and the county and the other taxing entities, to understand what they're doing. And ourselves, we're in the point that we're getting feedback from everyone on what you're experiencing and what the impact will be across the board. So we do collaborate. We also do within our own budget what we can. So we've kept our homestead exemption as high as possible. We've also raised our exemption for older folks and for disabled to do that also. And then we're just looking at, we're in the process right now of getting feedback from people so that when we vote in, I guess, in a month or so, we'll understand what we're talking about in terms of the impact on the community. And again, as Ted mentioned earlier, we're facing what we all are facing in our community. We are looking at limitations on resources that we used to be able to count on. At the federal and at the state level. And we're aware that that is causing additional needs at the local level for the folks that we need to take care of. So that is very, very important for us to step up to the plate. And we're trying to, our goal is to do that in a way that our community can handle. So we're taking feedback right now. We're proposing 8% because we think that we can do that in a way that has a limited impact in terms of additional taxes to our community. And we're balancing that with where we can, raising our exemptions as much as we can.
Can we also thank our interpreter? These guys, they're so amazing. They follow us around. They hit me in the back if I'm talking too fast. Anyway, they're amazing. I really appreciate them. We have a couple more questions that I'll take via our text, but Dr. Moody.
Thank you, guys. C2H works a lot with Central Health, and we enjoy our partnership in trying to get the word out, trying to let people in the community know, and trying to be that bridge of communication. But I have a specific question about the health equity issue. You know, we have older people talking about health equity. We have people in different parts of the community. What is the, and I may have missed it, and I apologize for being late, but I was actually working with somebody on their medication. What is the rollout process and plan to get this health equity piece operational, and also to make sure that that health equity rollout process is including the community voice and making sure that it's targeting the most, the people with the most needs, with the most funding, so that we can do the most with the limited resources we have, or address the greatest need. That's my question.
Thank you. I'll take a stab, and anybody else on my team is welcome to weigh in. Well, Dr. Moody, you and your team are part of that rollout. The healthcare equity plan is already in motion. This is year 3 of a 7-year plan to increase access to services in our community. We did a very robust study 3-4 years ago to look at where the greatest gaps were in our community, and many of those were in specialty care, and that's why, as Nikki pointed out, we are increasing our investments in all the specialty care services. That's on the operational care side, but part of it also is getting the word out to our community. And as Dr. Moody mentioned, C2H is one of our community partners that we work with. We've got to go where people live, work, reside, that perhaps aren't connected to mobile devices. Perhaps they don't speak languages that government entities often expect them to speak. They could be senior citizens. They may be afraid to be here and to show up. We are living in a situation where people who are not legal residents may be afraid to access care. And so we have a team of many who are working around the clock to try to make sure that they know how to get care, where to get care, and it's not about sending out a text. It's not about running an advertisement. In many cases, with partners like Dr. Moody's team, we are going door to door and sharing information. We're hosting what we hope are safe community meetings and safe spaces where people can access information and ask questions without fear of something happening to them. I'll just say it like that. We had a question today from a reporter asking about at our clinics, how do we make sure people are safer at our clinics? We have processes and staff training for people who are frontline staff, our doctors, our providers, our receptionists, to help our patients feel and be safe when they come to access care. So it's a multi-layered approach. There is not one simple way to get the word out. And with that, I would add, if you're here as a community partner and you are a patient-facing community advocate, and you can be a platform and you can be an ambassador to help us get that information out, we need you, because we can't do it alone just with our staff. It really is a collaborative approach that requires all of us to step up, all of us as community partners to be part of the solution. We can't do it without you. So we're thankful you're here, and we're also asking you to help us if possible. Yes, please. Oh, I think.
Yes, I would just like to also emphasize that we are funding and working with programs that focus in on that population. I spoke earlier about Manor, but we also have created, particularly for populations of color, the Black Men's Health Clinic. It's a program that we've been able to work with community care to be able to provide services for population that is significantly has high risk for mortality and morbidity. We're looking at building clinics in the Eastern Crescent, what we call the Eastern Crescent, roughly east of 35. We've already built Del Valley, we've built Hornsby Bend, and we plan on Colony Park. We're looking at being able to target populations, as mentioned earlier, who are Latinx, or those who are populations who, particularly during this period of time, are at risk for being brutally dealt with, unfortunately, the society we live in. So we're working on all of these together, but we need you all to let us know if these programs are working, and if not, what other strategies we need to have. So these meetings and other meetings throughout the year are those efforts that we're trying to get at to do those. We're partnering with our partners, such as those at Hungry Hill and Dr. Moody's group and several other partners, to be able to provide services there. So we're partnering and doing all of these. We're not doing it just of ourselves. And I just wanted to emphasize that, because that's the mention of the board. My colleague here, Amit, is going to do you want to say anything, Amit, with regards to some of that focus that we have? You know? Oh, okay then.
Thank you. Thank you, Manager Jones. And I'll just reiterate our gratitude for our Board of Managers. Our Board of Managers represent our community. They come from all walks of life, lived experiences, and they are oftentimes a voice of the community in terms of helping shape the strategy for Central Health. So we're deeply grateful. I have a question from somebody in the audience, and Tara, I think this one's going to go to you. What steps are being taken to prepare for the changes in Medicaid and access to federally qualified health centers for undocumented community members, which is what I was referencing early? If the plans for access are based on current needs gaps, they simply won't be enough, and we agree, and I'll let Tara take that one.
Thanks, Ted. So this is a really important question, and I appreciate whomever is the person who asked it. It's really two parts. One, I know that we have read quite a bit about the changes that are coming to Medicaid. The brunt of that change actually will not affect Texas. We did not expand Medicaid, which is why the support that Central Health provides is so important for our adult populations. Taking a look at what's happening with some of the ACA plans, this is something that we are monitoring very closely, and our CFO, Joy Sloan, is working very closely with the team at Central Health to see what that's going to look like as folks. We have a number of patients who, if premiums are hard, we do self-pay. There are some folks who utilize or use ACA plans where their premiums are going to increase, and so we do expect that they may fall into self-pay, and we will work on what that looks like. It's hard to know exactly how that's going to affect our bottom line, which I think when Nikki was talking about that $12 million of public health reserve, that's part of what that's been built in the budget to anticipate. To the question about what is going to happen given some recent guidance that we've received around immigration status and FQHCs, this is something that we're also, frankly, monitoring very closely. We were told that we would get more guidance from HRSA. We've been working very collaboratively with our legal teams, with our partners at Central Health. One of the great things about being an FQHC is that there's more than 1,000 of us overall. I will say that community care is the second largest system of its kind in the state and one of the largest in the country. So it's really important to us for lots of reasons, both our commitment to the community and serving all the patients that we are legally allowed to serve, because the impact on us may be greater than others. We are all holding steady and talking to FQHCs across the country. We are going to wait and see what the guidance look like. We are going to continue to plan to see how we might deliver care in alternate ways, and there'll be more to come on that, but really just waiting to see what the effect is going to be in the end, because we have not received specific guidance from federal agencies. And then the last thing I will say, and it goes to what Ted was saying before, we are looking at creative ways. We acknowledge that some of our patients, because of what has happened, may not feel safe. And so when we talk about telehealth and we talk about access, these are some of the things that we're contemplating as well to make sure that folks are confident in keeping their primary care physicians and taking care of their preventative health needs so they do not wind up in the ER.
I'm going to take a quick question, then I'm going to hand it over to Kermit for a comment or question. But somebody asked, how will the proposed tax increase be paid for? Is it sales tax, property tax? These are property taxes, and I think as one of the slides that Nikki showed earlier, Nikki, check me if I'm wrong, 90% of our revenue is based on property taxes, so local property taxes. So if you live in Travis County, we are the Travis County Hospital District, whether you rent, own, you pay property taxes, and so that's the primary funding source for Central Health. Kermit.
Peace, family. Thank y'all for this time. My name is Kermit Hyder. I serve as the Chief Operations Officer for Hungry Hill Foundation, and we serve long-term unhoused residents at our resource center, our ecosystem. We just like to give a big shout out, a big thanks to Central Health. The work that they're doing right now, the access that they are giving to unhoused residents. Every second Thursday and every fourth Thursday at our resource center, we have what we call a pop-up resource clinic. And we have other providers. We have Central Health on site, MAP eligibility. We have medical exam rooms on site, right? We have other partners coming out in order to service the most vulnerable demographic that needs to be seen, that are getting the lack of medical access, right? You want to think about the people who are living outside. They're not actually going to the doctor. You want to think about safety. They want to go somewhere where they can trust the provider. So they come to a place where they already built the trust and relationship with Hungry Hill Foundation. So they come twice a month in order to get access to their health care, to stay on their medication. So we want to give a big shout out to Central Health and all the work that you are doing, and invite everybody out to our resource center August 14th. We'll have a pop-up resource clinic. Central Health will be there. Unhoused residents will be served. We will have food on site. Our confidence closet will be open as well. So it's open to the community as well. Come check us out. We invite you all to set up a table. If you have services that you provide to the same demographics, please come in, and so let's take care of this together, right? We have to do it together. Thank y'all.
Thank you so much. Thank you. One more question from our QR code, and then we're happy to take questions from the audience. Somebody asked, what are your plans to keep UT students working in our clinics currently to actually stay? I can't speak for DelMed. One of the promises in 2012, when Travis County taxpayers voted on Proposition 1, which included the creation of a medical school, was to create a pipeline of doctors for our local community. And Del Med may have more specific local statistics, but I know there was a stat, and somebody on my team can probably shout it out, about the percent of residents who graduate from a medical school that end up staying in that community and practicing. So that is, what is it? 42% of graduates stay and practice in the community in Central Texas. So that is one of the goals. I know it's one of the things that Dell Medical School is focused on, but continuing to fill that pipeline of doctors for our local community. Anybody else have any questions or comments? Come to the back.
My goal, real quick, I'm going to say first, is to figure out who to connect into. A little bit of background with what happened in Sandy Creek. Sandy Creek's next to Leander during the flood. Still today, city, county, state, federal government really hasn't been there. 10 people died during the flood. And I heard about it and so got involved. We put together a group of 90 volunteers from around the world, deploying software and solutions all the way from the Netherlands to try to take care of that group of people. I can tell you more about that. I told that community that I'd come advocate for them. Part of what, who I am though is, my name's Kevin Coim. I'm the founder of Tech Ranch. Tech Ranch is Austin's first privately funded venture accelerator. Like, I've had more than 10,000 people go through one of my startup programs here in Austin. I'm one of the guys who started my first company here in '94. I don't think there's a lot of high-tech guys in the room. And part of what, when we talk about the feedback about what I'd really like to see to know that my tax dollars are being spent well, is, well, first off, you should know, I fundamentally believe in what you guys are up to. The number one block that the job creators, the entrepreneurs fear in this country is healthcare. They don't fear bankruptcy, they fear healthcare because it usually is what drives people into bankruptcy here. And so I know that firsthand because I ran these programs for 22 years here. I've got a lot of connections there. But what I'd really like to see is, I know it's hard to innovate when you're actually driving the car. It's hard to innovate. As an example, Dell Computer Corporation hired one of my companies to build their e-commerce engine years ago to disrupt their markets. And part of what I'd like to invite in this conversation is between the community health and the high-tech guys, the guys like me that are startup guys. Now, not all of them are attuned to this sort of stuff. I'm attuned to it because I took my grandmother, my grandfather, my aunt, my uncle. I don't really feel myself as a caretaker, but I ended up taking them all the way through the horrid issues around healthcare over the last 20 years of each one of their lives and saw what a mess it is in this country. And especially for me, since I've been in 22 countries doing work for other governments around the world over the last 8 years alone, I'm really surprised. And I know a lot of people in this room have a lot of anger about what's going on. I share that anger with you guys. So what I'd like to do, though, as an advocate, to be a helper, not just a complainer, is I'd like to figure out who the 2 or 3 relationships that I need to have to bridge between the high-tech world here in Austin, because there's absolutely no reason that if we can disrupt for a Dell Computer Corporation and drop the cost of their business by a magnitude of 10, there's absolutely no reason that we can't disrupt this as well and take care of our community, because what's happening in DC is abhorrent. And part of what I'd like to do, though, in really advocating for how we spend dollars is, I've got a group of tech entrepreneurs that are doing healthcare solutions from those 22 countries. I can tell you innovation that's coming from northern Mexico right now that is just absolutely disruptive. $2 test versus something that costs much more expensive in the American system. But what I don't know is, I don't know who are the 2 or 3 relationships that when I walk out of this door, I need to have. I don't want to have, my job doesn't allow me to have 20 and 40 conversations, but if I could have 2 or 3 relationships, I promise what I will see is delivered to this group is disruptive solutions, not incremental solutions. And I don't mean to take away from the two examples of innovation that y'all talked about in the course of things. But disruptive innovation looks different. You can't do it while you're doing your job. You have to have some crazy guy who flies around on airplanes looking at all the shiny objects in the world. And I have that, but I've been trying to figure out, I don't know who invited me to this meeting, but I'm really happy y'all did. So I'm here, and I have, we're about to launch a massive initiative called the Care Environment Initiative that has quite literally about 300 entrepreneurial ventures in other parts of the world. I need to have the 2 or 3 relationships, not the 20, but the 2 or 3 relationships. Now, if anyone wants to find me, my email address is kevin@techranchaustin.com, kevin@techranch. But yeah.
I got the contacts for you. So we're going to get your information before you leave. And our chief information officer is not here today, John Clark, but we're going to, thank you. That was fast. And we're going to connect with you because that's amazing. Thank you so much. I'm coming, Sharon, do you have a response to that?
I do have a response to that. Hi, I'm Sharon Alvis. I'm the CEO of Sendero. And pardon?
I'm one of your customers.
Oh, delighted to hear. We do a lot of that. I personally do a lot of that. In fact, I have a call this afternoon with someone in the high-tech industry, and so I would love to give you my card. I'd be happy to talk to you and visit with you about what you're trying to do. We are trying to be good stewards and try and be careful because technology can be a little scary if we don't do it right, but I'd love to visit with you further. So thank you.
Thank you, Sharon. Elijah? No, okay, sorry. I thought I saw a hand over here. Okay, I'm coming in circles. I'm going to get vertigo. Hang on one sec. Coming to a meet.
Thank you. And I just wanted to address the question and the invitation from Kevin. My name is Amit Motwani. I'm one of the board managers. And I appreciate, Kevin, you coming out and inviting us to communicate with you. And certainly there may not be a lot of tech guys in the room. There may be some tech girls in the room or some tech folks in the room who would like to connect with you. I would certainly love to hear your thoughts and also learn more about the initiative you're working on. And I have a little bit of experience in the tech world myself and might be able to help liaise. That being said, also, I think that there is a lot of legwork that needs to go into it. Disruption, of course, positive disruption is typically the result of a deep understanding of a pattern that preceded where we are today. And I think there's a lot of education that can happen on that pattern and a lot we can possibly catch you up on as well. So I'd be happy to steward that conversation and we'll reach out to you. So thanks.
That's a tech bro connection. It's a technical term, in case you didn't know. Okay, can I go here?
I wanted to go after Kevin because I need an idea for my problem. Mine is more feedback. I'm Kara Hanoka. I'm the Executive Director of Good Work Austin. We're the only organization in Travis County that advocate for food workers. So when we think about the last slide saying who's kind of left out of these solutions, lowest paid occupational group, 65,000 workers in Austin. We get all of our food from them every day. They're serving in our cafes, our restaurants, and most of them are uninsured. And so I was a food worker when I moved to Austin and didn't have insurance for many years. I think the Central Health is doing amazing work and exists to reach the most vulnerable people in our community. These are those people. And also, I think there's amazing innovative solutions like things that are going on with HAM, where we're able to reach people that are in jobs that are transitional and that maybe aren't tied to an employer. But definitely would love any disruption ideas and just advocating that these people are some of the most vulnerable people that are going to be impacted this next year, especially with cuts to healthcare, and just open to solutions. And thank you all so much for your work to advocate for food workers as well.
Thank you so much.
So we're going to...
Oh, I forget, sorry.
Wanted to mention and neglected to do so, and it relates to the situation on the guidance on how we treat undocumented individuals is that we are currently in the middle of a federal comment period where there is the opportunity for advocates such as yourselves to weigh in on how important it is for the good of all of us to make sure that people are able to receive care from community health centers specifically, regardless of their documentation status. If you want more information about it, as well as a comment from Community Care's CEO, Dr. Nicholas Yagoda, who could not be here today, please go there. There's a link that has instructions on how to comment. The period ends August 13th. On Community Care's website, communitycaretx.org, you'll find it there.
I just want to reiterate what Tara said. I want to reiterate what Tara said. Now is the time to speak up on these things, and this is a very specific thing that you can speak up on, and that could be very helpful. Thank you.
I wanted to speak to the comment from Kara. And it's very timely that you've mentioned this, actually. And it's also a great opportunity to shine the light on Central Health, Sendero, community care, and the entire enterprise when we don't really think that it's a Central Health thing. Kara mentioned HAM, and I think most of us are familiar with the Health Alliance for Austin Musicians, which is an opportunity for local musicians to be able to attain healthcare coverage, very often through the Sendero plan that's supported by Central Health. And that's usually when we think of HAM, we don't always think of Central Health, we don't think Sendero, we don't think community care, but all of these elements are intertwined in so many areas of the community and so many supports that we have that go beyond healthcare even, but are rooted in healthcare. That said, it's uniquely timely that you bring that up, Kara, because just a couple of weeks ago, we were speaking about budget initiatives brought on by board members, and one of the initiatives was to explore the potential for programs very much like HAM, but possibly for food service and hospitality workers. And I know that the staff is actually exploring ideas about how to potentially explore that, or even maybe pilot it. So glad you brought it up. Love to possibly tap you for guidance or at least input on how we might inform that process. Thanks.
We're gonna take one last question if there is one. I saw a hand. I knew I saw a hand over here, and then we're gonna wrap it up and send you all on your way for the rest of the afternoon.
On top of talking for old people, I work for a nonprofit. It's called Building Promise. And Building Promise is a reentry program that help inmates reenter into the community. Have you got a program? Because most of them has jailhouse mentality that we got to get them past. They've got other health issues, family issues that we need to, we are only peers. It's a peer-run program. So they can only talk about what's going to happen. But we see the mental health part that comes in, or the frustration. And before it gets so bad that they wind up back in jail or back back where they were, do you have something that you could help us that we could get them into so that we can actually get them out of prison to stay out of prison? Not just a revolving door where we get them out, you get them jobs, you get back in.
Thank you, ma'am.
At Community Care, we are working very closely along with Central Health on trying to support folks who are incarcerated. The other thing that I will mention that one of our board members, and I didn't get to talk about our board, is our board is more than 50% patient-led, and actually we do have one of our longest-serving member who engages in this work and visits folks who are in jail or in prison, and as they're about to exit, make sure that they're connected to what they need here in the communities. And so some of it is formal, In terms of our relationship with the sheriff, we're working really hard with Andy Brown, the county judge, to figure out ways that we can clean up that handoff. There are things that can happen within the setting, but making sure that they have a landing place. And so it is something that is on our minds that we're continually working on.
Thank you, and would also love to get your information because we love to partner with the community. Central Health, like Tara mentioned, Central Health and Community Care partners with the county and the sheriff's office. We do provide care in the jail for people who are involved with the justice system. We are currently providing specialty care for those, for people in the justice system. We're expanding that, and right now we're having active conversations about when somebody leaves jail, how do we ensure that they continue to receive health care? How do we connect them to MAP and other resources? And just know that that's something that is also a priority for us and we're working on.
So we're going to wrap up. First of all, thank you for being here. We are grateful for your time and your presence. And now, again, I'm going to ask you for your support and your help. We have a public hearing on September 3rd, Wednesday, September 3rd, at the Central Health headquarters, which is on Cesar Chavez. It's about 3 blocks from this facility. It's at 5:30. We would invite you to come to that meeting and share your thoughts or comments or feedback. 3 of our Board of Managers are here, but we have 6 others that aren't, and plus the entire community. Please come. Please let your voice be heard. If you have a meeting or you're part of an organization that would like us to come present and share information about our priorities and our budget, we'll be there. Just let us know, and my colleagues are here on the way out. We can take your information as you leave. And then finally, this one's for Kevin. Please sign up for text and email updates. You can text budget to 855-6227. And then you could complete a form on our website. I promise you, we will not spam you. We'll send you important information about meetings. We won't flood your phone like the 30 texts that I've gotten since this meeting started asking for money from politicians. We are not those people. So please, we'd love to stay connected with you. We'd love to be partners with you moving forward and continue our collaboration.
And I also want to let you know that the Board of Managers will vote on the budget. And I cannot remember the exact date that we'll be voting, but we will be voting after September 3rd. What is it? So on September 10th, the Board of Managers will be voting on the budget. It's our job to, as the managers, we set strategic direction for Central Health, and we vote on the financial matters and the budget. And then we'll make a recommendation to the Travis County Commissioners Court. It's their job to approve the budget. So just be aware of that. There's multiple opportunities, as Ted mentioned, for you to let us know what you think. And we really appreciate y'all being here today.
Thank you so much. Enjoy the rest of your Thursday, right? Wednesday. What days? Thursday. Enjoy the rest of your day. Thank you very much.